Hey everybody, today's our topic is on enteric fever. Just don't mind my handwriting, but I'll make ensure that you understand it properly, okay? So here we go. Enteric fever, it's usually caused by Salmonella typhi and paratyphi strain A and B. So enteric fever is a typhoidal fever which is usually caused by this typhoid strains, okay? It's a gram negative. It's usually a flagellate which is non-sporulating and it spreads through a fecal-oral route, incubation of 10 to 14 days, and food. Generally, think about the pathogenesis. It usually spreads with the food, and then it goes with to suppose there's a food handler, so given a food, or the food is contaminated. When you eat it, it gets penetrated into the intestine, and it spreads, goes to the Peyer's patches. It penetrates, and through Peyer's patches, lymphatic system, it goes through bacteremia and enters the bloodstream and causes bacteremia. Okay, so clinical features. Now here we have step ladder type of fever, which means that step usually the increasing temperature type of fever, and fever is associated with headache, malaise, chills. Okay, and the person is supposed to have this constipation initially, and later he may develop diarrhea, and then tenderness in abdomen and liver too. So, and the liver usually he may be developing this hepatosplenomegaly and relative bradycardia later, and he even develops this rose red spots, which are pale red macules of 2 to 4 mm. I would like to show you that before so that it will be more neat. So you can just see this, rose spots where you can see on chest and abdomen. So that is where the spots are. Okay, yeah. And then at the end of the first week, abdominal distension, tenderness in right iliac fossa. This is in the end of the first week. So, and second and third week, he'll be having many complications will be developing. So, stools is like pea soup stool because that is some kind of greenish yellow. So that's the reason the name is given this pea soup, okay? And as I mentioned here about the complications, let me just give you a brief. I mean, generally, when you see this pathology and all, you yourself can understand what can be. So, generally, you think about some toxemia, dehydration, peripheral circulatory failure, DIC. Okay, since it's affecting GIT, so as I told you, there's some perforations, penetrations, and all. So, just think of some intestinal hemorrhages, right? And then think when as I told you, it enters the blood and it can even reach to the brain also. So think of some neurological, something like delirium and psychosis and coma, meningitis, encephalopathies and all. Okay, and then miscellaneous, just say suppose it go and affects the heart, so myocarditis, endocarditis, pericarditis. So just think about it like that. Okay, yeah. Now going to the diagnosis. So the person can have this will be having this leukopenia. Leukocytes all decrease in count of leukocytes, and lymphocytosis he'll be having, so where the lymphocytes have been increased. So another diagnosis is this Widal test. Well, what is this Widal test? Generally, I'll say you, Widal test, why do we do? It's like the major aim of this Widal test is to find out the antibodies in our body. The salmonella will have three antigens, OH and V, this thing, virulent antigen. O is usually a somatic antigen, H is a flagellar, and V is a virulent antigen. Usually they are found in Salmonella typhi, okay? Salmonella typhi and both paratyphi A and B, right? So we test them to detect the antibodies, whether our blood, blood has developed any our immune system has developed any antibodies. To look after them, we just test them up, right? That's just a brief. Okay, and then there are other signs like dot enzyme immunoassay detects IgG and IgM, and ELISA coagglutination test, and counter immunoelectrophoresis PCR. So these are the tests. Treatment. Coming to the treatment, initially the person, you can give this chloramphenicol, which is of 3 to 4 grams per day till the fever subsides. And once the fever has subsided, you can just give 2 grams per day for total duration of like 14 days. Right? So initially you start giving 3 to 4 grams per day till the fever subsides. And later you start giving 2 grams per day for total duration of 14 days. Right? Amoxicillin again. This is like 4 to 6 grams per day in 4 divided doses till 14 days, right? And then clotrimazole, trimethoprim, which is clotrimazole plus you do this trimethoprim of 640 grams and plus sulfamethoxazole of 3 1200 milligrams in two divided doses we are supposed to give it. And for suppose if the person is resistant to chloramphenicol, amoxicillin, and clotrimazole, you are supposed to give ciprofloxacin. And we do give corticosteroids just to ensure, the patient to save from severe toxemia, CNS manifestations, and all. So, dexamethasone of 3 milligrams per kg loading dose followed by 1 milligram per kg every 6 hours for 24 days. Right, carrier state in typhoid, yeah, sorry. And so it's like eightfold excess risk is developing in gallbladder carcinoma. I just want to say this. Generally, a person having typhoid, most prone are women's, females. Okay, females who are more prone to this typhoid will be developing this gallstone carcinoma. Okay, sorry, gallbladder carcinoma. Okay, so how do you remove this? Cholecystectomy, ciprofloxacin you are supposed to give if the person is a chronic carrier. So for 4 weeks more, and you are supposed to do this cholecystectomy, right? Prevention is you have to give a good hygiene, sewage disposal, proper water treatment, all. And then vaccination is available. Typhoid 21A. This is strain is live attenuated strain, which is generally given to the older than 6 years, and one capsule every other day for 3 doses you are supposed to give. Okay, and polysaccharide is an intravenous which is given older than 2 years. Okay, one single dose. And then typhoid conjugate vaccine, which is usually given between the person between 6 months to 45 years old. In this between you give. Okay, so that's how it ended up. I don't know how far you understood, but hopefully I think you have got something out of this. You're benefited, I hope. Thank you so much.